Hello and welcome to another edition of Doc Talk. Coming up, we're going to talk with Dr. Rick Little, an orthopedic surgeon in Spearfish who started the orthopedic program back when it was Regional Health, now Monument Health, and we're going to be talking about total hip replacement surgery coming up on Doc Talk. Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, and welcome to another edition of Doc Talk. My name is Mark Houston, and joining me is Dr. Rick Little, an orthopedic surgeon up in Spearfish. Glad to have you again on a podcast with me, Doctor. Today we're going to talk about your hips, which I think mine are fine. They don't lie, according to some people, I suppose. But this whole process and these surgeries that you do as an orthopedic surgeon, you have to be good with your hands in situations like this, don't you? And have a desire to build, right? Is that kind of where this comes from, Doctor?
Oh yeah. You gotta know what you're doing. You gotta be good with a hammer and a saw.
That's when you hear the word saw when it comes, in conjunction with surgery.
I know it doesn't sound right.
Right.
It doesn't sound right. I understand.
But let's get into this, because this is another area that a lot of people, I'm assuming, is it generally people when they get older that have to deal with stuff like this? Or not talking about accidents or things like this with hips, but just kind of degenerative. Is that where most of this comes into play?
Yeah, the far majority are degenerative hip arthritis.
Okay.
There's some that have congenital issues, rheumatoid arthritis, that may get you a hip at a much younger age.
Really?
Yeah.
So what are some other instances where hip replacement might be necessary? Or is it generally those and accidents, things like that?
Yeah, accidents. Rheumatoid arthritis is one that gets younger people, obviously.
Now, can you explain what rheumatoid arthritis is?
Yeah.
Really quick.
So it's a inflammatory disease where your body attacks itself and attacks the cartilage inside the joint and wears it on out prematurely.
So that can lead to hip replacement?
Yep.
Oh my! I thought it was more of just. I've seen people, a lot of it like in their hands and
Sure.
feet.
Yep.
Is that generally where that comes from?
Oftentimes there's hands, feet, knees are very common.
Okay.
But we still get hips too that are hit with rheumatoid arthritis.
So I suppose then going to your general doctor to try some different ways to heal what you hopefully won't have to be a replacement is a place to start with this, correct?
Yeah, a lot of medical treatment, especially for rheumatoid arthritis. Really exciting new medical treatment there. I couldn't explain it to you all that one. We need a rheumatologist to tell us about those advancements, but it's really been fantastic. But most people, for the wear and tear, osteoarthritis, the mainstay, of course, is the anti-inflammatory medication, ibuprofen to leave over the counter to start with. Then we have prescription ones.
Okay. Well, let's talk a little bit really quickly, because again, if you're just listening to this podcast, there is a video component that goes along with it, and the doctor has brought in what looks like just the coolest piece of artwork I think I've ever seen, honestly, which is the actual parts that are used in a hip replacement. Can you just kind of explain, Doctor, how the hip works and what its function is?
Yeah, well, the hip is a ball and socket design with the muscles all around it to help support you when you walk and do your strides, sit up and down, stairs, up and down from a chair, that kind of stuff. So it's a ball and socket design. So what we do is we redo the socket. There's a metal socket that is falling off my model here, but it has a rough metal back, and we basically pound it in there. Sometimes we put some screws in it to hold it to the bone temporarily, but otherwise then the bone grows into the back of it and holds it in that way. So that just replaces the socket that's otherwise up in the pelvis. Just you pound it in there and hold it that way, okay? Then inside there is this plastic liner. That's your new joint surface. Then on the femur side, there's a metal stem that goes down the thigh bone here, and that's all titanium. It's a real rough area. The bone grows into that area. Then on top of that, we have a choice of a metal ball, or a lot of the women like this one here because it's pink. It's a ceramic ball.
Well, you're not going to be able to see it, ladies.
I know, but a lot of people look like, I don't want a pink one. Well, that's what it
Sure.
is. It's a pink one. But the ceramic wears a little bit better. And there's just a few less percentage complications with the ceramic compared to the metal. But that's some fine details there. But overall, it's all titanium, a ceramic head with a plastic liner, and then that titanium shell that goes in.
So what is actually being replaced in the hip replacement?
So imagine, on our model here, people can see it. The old ball joint's worn out. The cartilage on the end of the bones.
So
ground
that's
away.
what that is cartilage.
Yep, cartilage.
Okay.
So it's been ground away, basically. Okay, on both sides of the joint. So we basically cut off that ball joint. We get rid of it. It's not used for anything. Then we basically, I use the word carve, reshape, form the inside of the bone so it fits our metal component in there. And then with the socket side, I basically go in there with these hemispherical cheese graters, if you will, and we grind away the bone there so we get nice, healthy, bleeding bone, and then we can pound in the titanium shell in there. And this is kind of pounded in, press fit in there, then the bone grows in there.
I'm so glad you're out when this is happening.
Yeah. You don't want to be. I don't want to be awake when I have mine done someday either. Okay.
So are there technologies that help in hip replacements now? Like we're seeing so much. We've talked about ROSA and its use in knee replacement. Is there similar technology that's being used for hips?
Yeah. So it's there are some companies that do have a robotic technique, and it's mostly to place the socket in there. Okay.
Okay.
The placement of the socket is a critical aspect of this operation. In the old days, we always just say it had to be so many degrees this way, so many degrees that way. We know that's not true because people with low back disease, low back surgery, don't bend quite right. You have to place the socket in different positions. So years of experience will tell you how to do that. And then, the robotic technique will do that too. ROSA is starting to get into that area.
Oh,
there are
really?
Some other techniques, other robotic stuff that will help guide you on that also. But it's really the socket's the most critical part.
So when the ball part goes into the socket on there in your hip, why is it so? I mean, that seems to be loose and constantly moving and in motion. So why does it need to be so precise?
Yeah, so if you do not put the socket in the right spot, you might bend over, and then that hip ball joint might pop out.
Oh, I see.
The newer designs with the bigger ball and the better socket, the better plastic made, it's much, much more stable. Our dislocation rate's probably under 1%.
Okay. So
it's quite good that way.
When people decide that this is necessary and it's something they need to have done, what are the initial first steps when they come to see you with this?
Yeah, well, we evaluate them in the office first. Obviously, we get a set of X-rays. We look at leg length and mobility of the hip and everything else. Some people come in, they ground away a lot of the ball joint. It's quite short. Sometimes they're missing bone. They ground that away. So we have to kind of work on that stuff, work around it, I guess. And so it's really just, again, evaluating them. How's your hip? Is your activities of daily living revolving around your hip all the time? You can't do this, can't do that. I've had people sitting in wheelchairs for a couple of years and not being able to walk, and you end up doing their hips, and they get back out walking again and living life again. It's a great operation for those people severely affected by hip arthritis.
So how long does it take your hip to wear out? Is this something you gradually feel over time when it's kind of degenerative that way?
Typically, that would be the case. You'd
so it's
probably
not
feel
like
it over years.
Okay.
Now, that being said, I'll have some people with minor disease, and all of a sudden 6 months later, they have serious disease. Mm-hmm. So it's variable, but most people, it's a slow, chronic thing over years, progressively getting worse every year.
So when they come into you and they decide to start this surgery, and you're taking them into the operating room, how long is a surgery like this expected generally?
The time of that's highly variable.
Okay.
Some of it's easier for me, 45 minutes. Some of that's heavier person, very stiff, muscular. They can be an hour and a half, 2 hours.
I'm still amazed that that's the time. It just seems like this would be an all-day process to repair something like this.
Unfortunately, I want to say if your doctor's taking all day, then you need to find a different doctor.
That's very good advice, actually. So once it's all done, what's a recovery time on something like this?
So a hip recovers much faster than a knee. Probably because we don't have all the soft tissue swelling. It's in your buttock area, your hip area compared to your knee. So people don't seem to swell up as much. They're usually full weight bearing right away. Some people use a walker, crutches, cane. I have some patients that don't do anything whatsoever. I've had people 45 minutes after surgery get up, walk up and down the hallway and say, okay, I'm ready to go home. Everyone's a little bit different on their activity level afterwards.
What should people do to just increase their chances of this being super successful before it even happens? Are there things that you recommend they do before they come in for a surgery?
Probably the biggest thing would be just keep your overall health up, your heart and lungs. Try to get out and walk exercise. If you can't do that, try like elliptical, try like an exercise bike, something to keep your heart and lung function up. So after you get your hip done, you can actually go out and do things. Every now and then we got patients coming in, they didn't do it, they sit around, don't do anything. Now their heart and lung function is so bad, their risks of surgery go up.
Sure.
So if you just keep yourself healthy.
Okay, that's easier said than done in a lot of instances, but sure,
yeah.
Great advice. So when it's all done, then are there physical therapies that go along with this, or like you said, some people can get up and be like, "Nah, I feel great." Is it that type of surgery where you need a lot of rest in recovery with this, or can it be, no, the ball's in the joint and here we go, we can make it happen?
Well, maybe not as easy as that, but some people do recover that fast. I mean, some people are back to work in a week or two, depending upon what they do, of course.
Sure.
I mean, if you're doing construction, heavy equipment, heavy work type of thing, not only you probably want to take 6 weeks off, maybe even up to 3 months out, depending upon your job and what you need to do. Otherwise, people get back to things pretty quick. Like I said, when they come back at their 2-week visit, rarely do we have people on a walker at that time.
Oh, really?
Yeah, they're out walking without it at that time.
Now, how long does something like this type of replacement, how long does it last? This seems to me to be more, it would last longer than a knee replacement.
Yeah. Actually, I'd say the studies are probably about the same.
Darn it. Okay.
But I want to think that now with the newer plastic we have and now with the ceramic ball, hopefully they're lasting longer. But again, I'll tell you the answer in 30 days.
when you're retired and gone.
Yeah, and gone.
Why is titanium always seem to be the metal that's used in surgeries?
Yeah, great question. Believe it or not, titanium kind of bends like bone bends. Bone does bend. Microscopically, it does bend. And it has a similar bend, titanium component, a similar bend to what the bone does. If you put in a different metal in the thigh bone there, and you tell people to get up and get walking, the first 15, 20 steps, they have thigh pain because that stiff metal component in there doesn't bend like the bone bends, and they have thigh pain. And sometimes that takes even years to go away as the bone builds up stronger and stronger around it. So the bone likes titanium. In addition, very very few percentage of people have any issues with titanium as far as like a metal allergy.
Oh, sure. I suppose that's pretty important.
Yeah, you have more people with nickel issues, sometimes cobalt chrome, but that's why I like going to the all titanium stem with the ceramic ball and then the titanium socket. There's no other metals in there other than the titanium.
What did they used to use before you mentioned cobalt and nickel and titanium?
Yeah, this cobalt chrome ball joint. This would be the standard for years, and still a lot of people use it today, which is a great choice. It works great. It's a great bearing surface. But again, you have two different metals up. You have all titanium up against the cobalt chrome nickel ball joint, and a few percentage of patients have a little problem with that little junction. Metallosis, we call it, maybe galvanic corrosion. Different metals up against each other will cause some issues. But that's very rare.
Very rare. The ceramic, that's pretty interesting too, because a lot of, in my mind, when I think of ceramic, I don't think that it's something very durable, honestly. Yeah. But it must be much different in a medical capacity.
Certainly some earlier generations, you'd have that ball and all of a sudden explode inside the hip joint. I know there's reports of this newer generation that happening. I've never personally seen it.
Okay.
I have personally seen the other previous generations, but not this one.
Are there some exciting new stuff that's coming out maybe down the line that's just not quite ready for these kind of surgeries, hips or knees or things like that? Outside of robotics, are there other things that are coming down the pipe that you've seen or are interested in?
I don't know. That's a good question there, too. I mean, there were some shifts for a period of time called resurfacing, but they're using a metal ball inside the metal socket. That had its own set of individual problems. That was exciting technology at the beginning, but it didn't really pan out. It's kind of settled in that this is the design there. Other than, like you said, the robotic technique of putting it in. That would be the thing in the future, probably.
Now, what about, this might be a really strange question, but, we can do so much with cadavers.
Yep.
Taking healthy hips from someone healthy that has unfortunately passed away, and putting that, has that ever been looked at? Has that ever been a thing?
Yeah, that has been tried. I don't know what the results are on that one. I just know they didn't work. Overall,
well, I suppose you would need to get the blood flow into everything, and
so that's really not a thing. Of course, the stem cell aspect, you're kind of
there we
that
go.
a little bit.
Yeah.
So you think about that and say that should just be exciting technology. Bottom line is the stem cell injections into the joints hasn't panned out to work.
Really?
I think there's going to be someday in the future, but you got to get that delicate little cell and put it in a certain area and tell it to stay there and start growing there. So how do you do that? Well, you have to have some type of matrix to hold it in place. We're not there yet. There are some things about the knee that we're doing that way, and someday the stem cell might be the way to go, and this surgery may go away.
Well, we don't want that. Still need you guys in the room all the time for this. Dr. Rick Little, an orthopedic surgeon from Spearfish. It's been a lot of fun talking to you again about this, Doctor, and I'm so glad you came in. I appreciate it.
Again, thanks for having me, Don.
You bet. Thank you.